Growing concern about a new subvariant of Omicron, now the dominant COVID strain in the U.S. It's called BA.2, and according to the CDC, it makes up more than 72% of positive cases nationwide. So let's bring in Dr. Céline Gounder, editor-at-large for public health at Kaiser Health News and an infectious disease specialist and epidemiologist. Dr. Gounder, good morning. I guess we should point out it's great to see you well, because the last time we met like this, I was unknowingly COVID positive and found out about 5 minutes after you left set. So you're healthy.
I am healthy.
Aren't you like, good to see you, Tony?
But now you can be pretty confident that I'm in good shape.
Yes.
You know, get that immunity the old-fashioned way.
Yes.
I wanted to begin with a general question, which is the governments of our country seem to be putting responsibility back on individuals to decide how to handle the pandemic. So how should people be thinking through both their personal risk and how they expose others?
Well, I think that's precisely how you should break it down. What is my personal risk? So what is my personal health risk? What is my personal job risk? So, for example, you and I, if we have COVID, we can't be on set. If I have COVID, I can't be at my job in the hospital. Mm-hmm. And then finally, what is the risk to the most vulnerable people in your life? So maybe it's your grandmother, maybe it's that 6-month-old child. So I think that's how I break down how do you think about the risk. The CDC does have a website that shows you community transmission and community risk. I would be careful in interpreting those numbers, that green, yellow, red. It really tells you if you get sick, the hospitals will be able to take care of me with normal standards of care versus crisis standards of care.
I just don't trust the personal responsibility. I don't think people tell the truth about it. Now you can go to restaurants, you can go anywhere. They're not asking to see your vaccines anymore. So you're in a room with a bunch of people. You don't know if they're vaccinated, not vaccinated. How are we supposed to move in the world these days? Who are we supposed to trust? What are we supposed to do?
That's a good question.
Yeah, it's a great question. I mean, the only people we can ultimately trust are ourselves, and knowing that we can do the right thing. We can get vaccinated. If we have symptoms, we can get tested. If we're infected, that we stay home from work or we don't go to school. I think things are about to get a whole lot harder for people, though. The government funding for testing and vaccination treatment for people who did not have insurance, that money has run out. And so now you're going to start having to pay for things out of your own pocket.
Yeah. There's another new subvariant of Omicron called XE that was found in the UK. Should we be concerned about it here in the U.S.?
I wouldn't get too alarmed about this just yet. It's basically a cross between the original Omicron and this new BA.2 Omicron. We don't know a lot about it yet, but it doesn't really seem to be more of a threat than the original Omicrons.
So cases are declining here, but they're rising in the UK, and there's been a Shanghai lockdown. Is what is happening overseas a sign of things to come for us?
It could be. It's a little early to say. I would look to the UK as the best predictor of what may be in store for us. And there are some concerning signs. So they are better vaccinated than we are, especially their elderly are better vaccinated and boosted. And of course, they're the ones that are highest risks. And we're seeing hospitalizations go up, nevertheless, in the UK. So we are sort of, on watch, and we'll see what happens.
Where do you stand on that fourth booster? Because now they're saying people 50 and over should get it. Do you think that you need to do that? Do you think everybody should get it? And if you do, is it okay to mix the vaccines? Does that make a difference?
So if you're over 50 and you want a booster, you can absolutely get a booster. The recommendations...
Should you? Yeah,
the recommendations are if you're over 50 and you have a chronic underlying medical condition, let's say diabetes, that you absolutely should get that fourth dose. Not everybody knows if they have one of those underlying medical conditions, and so that's why the guidance is pretty flexible.
But what if you're over 50 and you're healthy? Do you think you should get it?
I think that's really up to you and your personal, discretion, depending on your sense of risk. But you are absolutely eligible if you're over 50 to go get one.
But are you better covered? That's what I'm saying. I'm over 50, but I'm thinking, are you better covered if you get it? Or does it make a difference? That's what I'm trying to figure out.
Yeah, so if you've already had 3 doses, you get a 4th dose. The data from Israel shows you have a temporary, maybe 3 to 4 month boost in your immunity.
So that's it?
On top of what you already have. So I think the key message is that your 3 doses already do a lot to protect you.
Dr. Céline Gounder, thank you so much. Valuable information. And Gayle, I would have thought early 40s. You don't